As First Lady and in my professional career, I continue to be committed to promoting programs that protect and support the health of New York's children. Governor Paterson and I believe that all of us share a common obligation to ensure that our children have the opportunity to live healthy lives and are given the promise of a healthier future. But to have that healthier future, we need to address what is perhaps the biggest challenge to the health and well-being of our youth today, the obesity epidemic, which not only adversely affects children's health, but it threatens to shorten their lifespan. As all of you know, the obesity epidemic touches all ages, all neighborhoods, and all socioeconomic groups in New York State. 1 in 4 children is overweight or obese, and in low-income neighborhoods and neighborhoods of color, that number is as high as 1 in 3. Even though New York State has a strong requirement for physical education in our schools, the recommended 60 minutes of daily physical activity is not enough to ensure good health for our youth. The governor has proposed state legislation and programs to improve the nutrition of foods available in schools, reduce the availability of junk foods, and increase the opportunity for physical activity. He proposed again this year the Healthy Schools Act, which would require the establishment of nutrition standards for all food, school's lunch, school's breakfast, and outside food sold or served in schools. The governor also proposed and signed into law this year the Healthy Foods, Healthy Communities initiative, which offers a new revolving loan fund to increase the number of healthy food markets in underserved communities. Additionally, our administration is working with schools, communities, and farmers to develop and expand the Farm to School program to promote the use of local fruits and vegetables in schools and to support edible school gardens. The governor's office collaborated with a wide group of partners and stakeholders in New York, including the YMCA and the Boys and Girls Club, to set model standards for nutrition, physical activity, and television and video game limits in after-school programs. And we have worked with our healthcare providers and more than 400 child day care centers to provide nutrition training, education, and guidance to staff and parents. For my part, I created a program called Healthy Steps to Albany, First Ladies Challenge. This challenges teams of middle school students, grades 6 through 8, are challenged to walk 4 million steps over a 6-week period. Everyday activities such as biking to school, taking a dance or karate class after school, or going for a family walk after dinner were compiled to help the classes get their steps to Albany. The Healthy Steps to Albany program is unique because students are asked to think about the many ways they can increase their daily physical activities. With the support of their teachers and friends, students are encouraged to turn off the TV, put down the video game controller, and be physically active. I chose to focus on middle school students for a number of reasons. It's at this age that many students are uncomfortable with their changing bodies because they're going through puberty. And students show that children's physical activities level, and studies show that children's physical activities levels decline significantly during middle school years. Today's youth spend an average of 32 hours per week in front of a TV, video game, or computer screen. This greatly exceeds the recommended limits of 1 to 2 hours maximum per day. Although I started Healthy Steps to Albany in Harlem before I became First Lady, this spring we expanded the challenge to 5 large cities upstate New York, in Buffalo, Rochester, Syracuse, Albany, and Yonkers. Nearly 270 classes registered, and the students walked more than 1.4 billion steps while mapping their progress across New York State. In addition, students had the opportunity to earn steps by making smart food choices. All the students benefited because the 13 classroom teams that walked the farthest earned a number of prizes, including a visit to a local organic farm where they learned how food is grown and prepared. Tomorrow, the governor and I will be in Buffalo to share a healthy lunch and present awards to the Buffalo and Rochester winners. When I took the students from Harlem to a farm last year, I realized how far our urban youth are from the sources of their food. One student told me she didn't realize that cheese came from cows. She just thought it came from the grocery store. Another student never made the connection between potatoes and potato chips. If students do not understand the origins of the food they eat every day, they cannot understand what they are putting into their bodies. Students learn not only in the classroom, but also in the cafeteria, the halls, the gym, the schoolyard, and their neighborhoods. They learn from teachers, parents, classmates, and neighbors. They learn what they see. And too often, in too many schools, students see high-calorie, low-nutrient foods and beverages. Today, more than 1,000 schools in New York have already implemented comprehensive wellness policies, enhanced nutrition standards, and increased the time of physical activity. I believe we can do better. We need federal legislation that raises the nutrition standards of all foods and beverages available in our school. Many of these standards can be addressed in the 2009 Child Nutrition Act reauthorization. We strongly support your efforts to request that the USDA strengthen by regulation the nutrition standards governing the federal national school lunch and school breakfast programs, as well as to impose stricter federal standards on competitive foods sold or served in schools. As you do so, be cognizant of how schools got into selling outside food in the first place. They had to compensate for the deficits caused by insufficient federal funding for the school lunch and breakfast programs. As you advocate for improving standards for school food, I ask you to also examine the cost to states to supply healthier foods. I am confident you will find that school food programs are severely underfunded. Improved federal nutrition standards and reimbursement for school lunch, school breakfast, and competitive foods, combined with programs to increase physical activity, will help children and adolescents establish healthy behaviors. In turn, students will be healthier, will have lower obesity rates, obesity-related diseases, and they will have lower health care costs. It can also contribute to increased capacity to learn, higher academic achievement, and greater success in school and their careers. We look forward to working with you on these important goals as the Child Nutrition Act reauthorization moves forward, and I thank you for your time and attention.